Hi, Dr. Joy. I am so honored to speak to you today. I've been secretly watching all of your YouTube videos because I'm super into peptides, I'm super into stem cells, and I'd love to talk to you all about stem cells today.
Fantastic. Let's do it.
Well, so where are you?
I missed that part. Where are you? What?
Okay, here we go. My microphone turned off. Dr. Joy, where are you located? In LA?
Los Angeles. Yeah.
Los Angeles. Okay. And let's start out with like the basics. What are stem cells? What do they do for us?
Oh, stem cells is only the starting point of life. So you and I, if you don't know what we were when we were a fertilized egg, that was the quintessential stem cell. So we all came from that single point. But as the egg starts to divide and migrate and involute and forming shapes, all those early cells were stem cells, but they were all a little bit more differentiated compared to the initial fertilized egg. So as you divide and gain more function, you lose certain potentials. So there's this extensive ladder of evolution of these cells. In our body, we still contain various stem cells, but we all came from initial this evolution, this extensive map of stem cells. So yeah, the characteristic of a stem cells is that they're able to divide and replenish itself. So that's one of the reasons. And then they can gain function and replenish the tissue that they're residing in. So they're able to, um, you know, make these division where it preserves a copy of itself, but then make a copy of something that's more differentiated. So that's one of the main characteristics.
Yeah, I have to tell you, I started to get interested in stem cells because I don't know if you're familiar with ankylosing spondylitis.
Yeah.
That's what Craig suffers with. And I was like, Craig, I think that you should go and get stem cells. And he's like, he's tried everything and nothing works. And so he's just so sick of being let down with things not working. He's like, well, why don't you go and see what it's like and tell me and things like that. So I thought that you could only get embryonic stem cells in another country like Panama, like Mexico, but can you get them in the United States?
Okay, just to make a clarification, when we talk about embryonic stem cells, that's a whole different category. That's when cells were developing, the fertilized egg started to form a little ball of cells. So these are day 5 to 7 days, after fertilization. And that's when there are these little cells within the ball of this structure that's called embryonic stem cell. Those can be taken out of the cell and utilized to form different cell lines. And those are actually not legal to be used in clinical practice in the US. Some other countries do use it, but we have trouble controlling the fate of these cells. They can go haywire and form something we call teratoma. I think part of the reason is because genetically, when we form a new baby, how many times it results in abortion, not abortion, a miscarriage, because a lot of times genetically they're not, uh, not correct in the coding. So that will lead to this, leading to a dysfunctional fetus, and that gets aborted. So when it hasn't gone through the test of fire, which is the entire pregnancy, if
Yeah.
everything goes right, then you get a fully formed, healthy baby. But all in between, if genetically something was not right, or even, there's some vulnerabilities that's affected by the environment, then you can form something called teratoma. So there's a risk of teratoma, which is uncontrolled growth of cells forming a cluster of disorganized structure, hair, nail, bones, everything sticking out. So we don't have a good way to control these embryonic stem cells. So when we talk about embryonic stem cells, those are the cells that we're referring to, not in the United States. But
I'm
you
glad
may
you
be
I'm glad you
alluding.
said this. I did umbilical cord. I'm so sorry. That's totally
Exactly,
different. Yes,
exactly.
yes.
Well, it's a
I'm
so
glad you covered this
common.
though.
It is so common because people are still on this on YouTube asking me, oh, you can do embryonic stem cells. No, I've never done, and I don't know anybody in the US that actually is doing embryonic stem cells. You can use embryonic stem cells to do research, but people are confusing the two. We're not destroying embryos, right? When you say embryonic stem cell, that means you're destroying an embryo, and that, there's ethical ramifications. But when you do umbilical cord stem cells, you're waiting for the baby to be fully formed, fully born, and of course, you're going to have to cut the cord, and the structure that's birth tissue usually is tossed in the biological waste basket. But now we can extract cells from it and utilize it. So, yeah, so umbilical cord stem cells are allowed in this country if you do not manipulate it in a way that changes its structure. So the FDA says if you start to use enzymes or chemicals to change the cells in any way, or if you start to grow them into huge numbers, then you are actually modifying the cells, which the FDA says that means you're making a drug. Then you have to go through drug studies. This is why all these companies are going overseas, because they say, we're giving you 150 million cells, 300 million cells. There's no way economically they can give that kind of number of cells, without expanding them. So they have to put these cells in a culture and let them grow into huge numbers. But the FDA says if you do that, you're changing the cells in certain ways, and you have to go through investigational new drug study, IND, and that is very costly, both in time and money. And that's why all these companies decided, well, we'll just go do it overseas. But the myth persists. The myth is that you can't do it, you can't do stem cell treatment in the US. You have to go overseas.
Yes,
That
that's what I thought. I thought that it was only you could get it from your own fat or something. And I was like, well, that I don't want sick cells, I want healthy cells, right? And so that's
You're
why
among the hundreds of millions of people in the US who still
that's why
think that's the case. And even in Tony Robbins, life force, that myth is still being perpetuated. So I'm actually going to do a
Joe
critique on the
Rogan.
book. Yeah, I'm going to do a critique on the book because I need to give people the correct information. Just
Yeah.
because there are some people who have been doing stem cells who have some knowledge on stem cell therapy and are proclaimed experts doesn't mean that they have all the facts and information correct. So the correct information is that you can do stem cell therapy in the US if you're using these cells completely as unmanipulated sources, and you're using the cells in a way that whatever the cells were doing in the donor's body was what the cells are doing in the recipient's body. In that case, the FDA says, then you fulfill the criteria of tissue transplantation. You're not making a drug. So to perform tissue transplant, just like a doctor can give a patient a blood transfusion or an organ transplantation, right? This is part of what doctors can do, bringing tissue from one person to another. That's part of the practice of medicine, is not using a drug, so it doesn't have to go through the drug approval. So a lot of doctors, I would say most doctors in this country, including myself, are operating under that kind of guideline.
I'm so glad you brought this up because I mean we're hearing this all over YouTube. It's not just here that this myth. I really thought that you could not do it with embryonic stem cells in the United States.
You mean umbilical cord?
Umbilical cord. Geez, I gotta stop saying that. That's confused everybody. But I've been watching all of your YouTubes about stem cells. I encourage everybody else to watch these. But you were talking about some of the testimonies. Can you tell me just how amazing like these transformations that you're seeing with health?
Yeah. So first of all, I want to make sure that I'm not making any claims, because the moment you say it can treat certain conditions, then you're really dancing at this border of getting in trouble with certain entities that govern us. You can only make claims if a certain treatment has gone through FDA, drug approval process. So that's one thing I want to make sure I mention. So, but these are, what I've seen, the doctors who are treating different patients who I've trained have seen. So there are some really remarkable results. If a person has been suffering from something for years and years and nothing was working, and then they get stem cells and everything's improving, I think people deserve to know, right? It's like, hey, Guess what? I went into this profession to help people, and I have something that seems to be doing something really amazing, really helping people. I mean, I've seen things from Lyme disease to autoimmune conditions, various autoimmune conditions, rheumatoid arthritis, um, lupus, psoriasis, and I've seen, of course, a ton of musculoskeletal problems, from plantar fasciitis to tendon ligament injuries to bone, defects, injuries, to neurological issues, multiple sclerosis, Alzheimer's, people with Parkinson's, and traumatic brain injury, spinal cord injury, and then we have different organ injuries. I've seen people's, thyroid nodule disappearing, liver cirrhosis, uh, having a reversal, COPD, getting off medications, getting off oxygen supply, and kidney failure, people with or just metabolic diseases like hypertension, diabetes, and people with more obscure conditions like testicular swelling and inflammation, and yeah, they're just never cease to surprise me, because a lot of times when people come to me with different conditions, I will look at what kind of research is available. So if there's no research done, especially when something is more obscure, plenty of people suffer from things that are more obscure that no one has conducted study in, then I'll just analyze what caused the disease in the first place and how stem cells work. So if the way stem cells work, is targeting the mechanism of the disease, then there's a chance that the stem cell therapy can work, right? So what are the mechanisms of stem cells work? The mechanisms, anti-inflammation. Of course, I would say probably 90% of the diseases will have inflammation as part of the, problem, because even if you have a genetic condition, just the changing genes sometimes may not give you the downstream effect, except that, the change in genetic coding may eventually lead to something like organ dysfunction, cell dysfunction. So even if we can't change the genes, but we may be able to change the effect and reduce the inflammation or the immune dysregulation. So shifting the immune system, that's another aspect of how the stem cells work. And I'm mostly talking about mesenchymal stem cell, which these days are kind of the gold standard. Not that other type of stem cells are not important and not helpful. I utilize a population of stem cells, in my practice, because I do believe in synergistic effects. Not just I believe, is because I've seen so much study on various cell types and how different cells can work together. So you want to bring different cells, into one roof and have them talk to each other and exert the maximum benefit, right? Our body is a little universe. So there's a reason we have all these cells around. So you want to bring them in. These are all primitive cells. But mesenchymal stem cells, because it's talked about so much, and the main mechanisms, besides the anti-inflammatory and the immune modulating properties that can help break down scar tissue, powerful antifibrotic properties. They can help fight cancer cells. They have anti-cancer properties. They can send out ligand that help the cell to burst into death, to trigger the cell to go on programmed cell death. They can also rescue damaged stem cells, damaged cells that didn't have to die, because sometimes when we have injury or ischemia, neighboring cells may die, and so mesenchymal stem cells can rescue them. And it also has properties of angiogenesis, so promoting more blood vessel formation, so then you can supply the tissue that you're trying to help, right, trying to repair. And then there are antimicrobial properties. Yeah. So
Is it true that 80% goes to the heart right
no,
away?
no,
No.
I think there was earlier reports, from some studies. Sometimes in scientific realms, things get stuck at one study, two study, then everyone talks about that. That became the thing. So the thing that people are stuck on is that, oh, if I give you stem cell through the intravenous route, then the majority of them will be trapped in the lungs. Uh, Initially, a lot will be in the lungs, and so will a lot, settle or be shown in the heart in the spleen, in the liver, because these are highly perfused areas. So these are the places where there's just huge amount of blood supply. Yes, initially, if you put in the blood and there's a lot of blood in a particular organ, you're going to see a lot of these cells. But if there's no problem in those organs, there's nothing to keep the cells there. So when they actually did study looking at how long these cells persisted in these organs, in the lungs, where they're probably the huge number, like you mentioned, something like 80%, within 3 days, they're gone. You can't detect them anymore. So yes, initially they were there, but if you don't have lung fibrosis or inflammation, the cells are going to get out and get to other places where they're attracted to. So no, that's another myth that people think that that it's going to be staying in certain organs.
Well, do you primarily do IV injections or do you do all different types? Because
I do all
I've
kinds of injections.
okay.
It really
So you
depends on what the person
do
needs.
like beauty kinds, right? Like you
Oh
inject it in the
yeah,
face. Yep.
yeah, we can do facial injection, hair, penile, vaginal. We can inject into all kinds of joints, musculoskeletal for
That's what I was
repairs.
so shocked at. I met there was about 40 people in our group and most of them were men who were ex wrestlers or some sort of sporting injury they had, whether it be a shoulder, a knee, whatever, and they said it was so painful that injection, but once it was in there, they've never had so much relief and they've tried everything. They said they've
Mhm.
wasted thousands and thousands of dollars on other treatments and this was the first thing that finally worked and they plan on coming back and stuff. So this is why I
Mhm.
wanted the message out there because I think that we're searching for something and we think that stem cells are so taboo, but they're really not.
No, no. One day it's going to be so mainstream that people laugh at, what's going on these days. And, why? Why the restriction? Why the suppression? Why all this? Oh, well, it's because we're changing the paradigm. The old always die hard. When you look at medical history, the history of medicine, when there's something new emerging, there are plenty of people who are, blasting it, calling it quack, and so we're at that transition, and the shift is fast. It's kind of fun to watch the change. The people who love the science, who are open-minded, who are willing to read some articles, and they are super excited. But the people who really, really just are locked in the previous paradigm, boy, are they adamant about no evidence. It's laughable because my question is like, have you looked? Have you looked for evidence? Would you like some evidence? Would you like me to send you some evidence? I mean, to say that there's still no evidence is it's really laughable. But that's the state of medicine in so many aspects. But the stem cell therapy, is not an end all be all and cure all, but it can certainly. I've seen it. This is why I'm passionate about it, because when I see results and being able to be such an effective healer, right? That's what we want it to be. Majority of the people who go into medicine are going in because they want to heal people, they want to help people. Some may want to go in to make money, but I have a mission in life, and I have a purpose, which is to make a difference. That's what drives me. So seeing that kind of results is what's really powerful. And I think one day it's going to be as common as antibiotics. I always say, yeah, if you want to do surgery, of course, surgery is important. I love, what modern medicine has done with surgeries. So, we can fix people in a quick and drastic way. But if you just use some stem cells, instead of using antibiotics to prevent inflammation or prevent infection, just do some stem cells, and you're going to heal twice or three times as fast, and you're going to have a lot less scarring and better healing. It's just going to be part of what we do. There's going to be no mystique about it. No one is going to think that this is fancy. That's just
That's why I love
we
it
know more,
because
we know better
it's like
now. Yeah.
natural healing. Yeah, I just love it. It's like natural healing, it's not a medication. It's just our bodies trying to heal us in a natural way. But how do they help with aesthetics? How do they help with the beauty stuff? If you inject it into the
Um,
face,
Yeah, again, the anti-inflammatory action and the action of what we call paracrine effect, which is sending signals to the neighboring cells and letting them repair and replenish. They're always, their fibroblasts or their different, skin progenitor cells, right? To replenish, we're always shedding, we're always producing new skin cells. So if we can help these cells to produce more collagen, help them to be healthier, more active. There are various mechanisms of the stem cells, I haven't talked about. One is the mitochondria transfer. So fresh new cells have fresh new mitochondria. We always, these days people talk about mitochondria dysfunction. So if you can, these new cells can send their new mitochondria to your own skin cells, that elevates, the energy within your own skin. And then it will produce these effects where it's going to trigger these cells to start dividing, making new cells. And of course, when you calm inflammation, then you're promoting regeneration. Inflammation, it happens all over our body, and that reduces the ability of these cells to really fully be functional. The stem cells secrete exosomes. These days exosomes are very famous and popular, but it is never going to replace stem cells. However, stem cells do secrete these exosomes as a way to communicate with other cells and with the world. So these exosomes also contain what's called microRNAs, and these little pieces of RNA can go across cell nucleus. So it can go into the neighboring cells, get into the cell nucleus, and start repairing the DNA. So there are many ways that these cells can work to help your own cells to be healthier. So, then the end result will be, better, less thinning, right, of the skin, more collagen production, healthier cells. So reverting back to the younger state. So if you think about your skin when you are, 20 years younger, there's a difference in how it repairs itself, right? So
Well,
that's what
that's
we're aiming at.
I have to say,
Oh,
like, I had to pick this up because I've been watching you for quite some time now. And then when I heard that you did your own stem cell face cream, I was like, oh, I need to try this. And I just started it, but I mean, love it already. I did have a question. If you microneedle at home, is it safe to use that after a medical microneedling? And I'll have a link if anybody wants to check, because if you can't get stem cells injected in the face, why not use this, right? But is it,
exactly. Yeah. I really developed the cream because I wanted a really great cream. The skin is the most absorbent organ in your body, right? To put something that's really healthy, non-toxic, and powerfully regenerative, that was my goal. And it was really hard to find anything like it until I got disappointed, by various expensive products, Korean, whatever, European. I decided, what, I just have to make my own. So that's how the product came about. It's 100% natural. It's got stem cell components. It's got all these peptides and lots of antioxidants and herbal extracts and prebiotics. So I put everything in one. What Because it's so natural and so gentle for the skin. We use it for post procedure. So we have a laser machine, photona machine in our clinic. So after procedure, that's what we put on the skin. And I have used it for microneedling. Just, that's all I do. I just put the cream on my face and I do microneedling, knowing that I'm getting the cream even deeper in the face. And it's fantastic. Absolutely love it.
even if you do medical microneedling where it's deeper, that's
Mm-hmm.
okay. All right.
Mm-hmm.
That's good to know. Because they say, don't put vitamin C on your skin, anything like that. So that's good to know.
Yeah, yeah, it's very gentle. You're driving some of the stem cell and peptide, components deeper into the skin. So yeah, it's
Well, your skin looks fantastic, so I'm gonna just keep going on it. Maybe my skin will get a little. So,
yeah,
uh,
yeah.
you said that there's also peptides in here.
Mm-hmm. Yeah,
And
like
is
the famous copper
GHT?
peptides. So there's a,
Okay.
there's a list of peptides. Yeah, it's a proprietary concoction of peptides. The helping with reducing inflammation, reducing fine wrinkles, promoting collagen production, reducing pigmentation. So there's group of peptides that help with various aspects.
Yes, I'm very. I started getting into peptides for my husband also, and then here I'm down a rabbit hole, injecting myself with peptides all the time. I think that's another fascinating new way to heal your body naturally. And peptides come from amino acids, which are from protein. But some of them are like, do you use them in your office also?
Yeah, I use a lot of peptides. What I realize is that peptides are very targeted. Stem cells are, it's very global, have this, very holistic mechanism that's, talking to your whole body in various ways. And then peptides, we can target specific organs and specific functions, like the growth hormone peptides, right? I mean, it still has a wide range of benefits, but you're targeting the pituitary and helping it to secrete more growth hormones. You can target the immune system, you can target the brain, the copper peptide, the skin and the nervous system. So there are various, it just gives me more tools. I feel more effective that, I can give you something global, but we can also really, really work on something that you are, the things that improvements you're looking for.
That's such a great way to put that, how that's global versus more, specific. I love that. You were talking a lot about the different myths. Are there any other myths that you'd like us to know about stem cells?
Yeah, I think one myth is that people think more is better. And it's really just not true, depending on what it is. There are studies specifically looked at dose response. So the more is better up to a certain point. And then you kind of reach the point of no further gain. Not only no further gain, sometimes you have a little bit lessening of the effect, which is interesting, that deserves, kind of understanding. But if you're using the exact same cells. But now if we're talking about using more, but these are expanded cells, the cells have been grown in a culture and they have been changed in certain ways, because when you grow them to huge numbers, you are putting them in an incubator, and the cells are superbly adapted to the incubator, but not to your body. Your body is way more complex and interesting than an incubator. So then you're producing all these cells that are perfectly suited to adapt to the incubator, because the cells are under stress. When you put them in incubator, you try to make them grow. They're under stress. When they're under stress, when they divide, they will divide asymmetrically. So they will divide into a cell that has further function. The problem is that then they're losing some of the stem cell properties, and they're gaining more of the downstream properties. As you gain function, you're going to express different surface receptors. You start to kind of manifest yourself. So if you came from, some donor named John, and John's characteristics is going to start to show up on the cell. So, and then when you give John cells to, somebody named, Joan, and then, Joan may not like those,
No.
what belonged to John. But
Yeah.
if you put John's cells without expanding it into Joan's body, Joan's body could be just, working with it, because the cells from John will realize this is a new environment, this is what I need to adapt to, and not to express those surface receptors. We know that because we've seen how young cells interact with the host versus a more mature cell, like bone marrow transplant, right? So if you have one person's bone marrow to give it to another person, you have to do matching. And even perfectly matched bone marrow transplants can, there's a chance of rejection. So perfect, when we say perfectly matched, it's impossible to match one person to another, right? We're matching certain main markers that we know that can cause severe reaction, but still there could be a lot of other things that's causing problems. But if you give umbilical cord blood, which is very similar in composition to the bone marrow, if you give cord blood cells to a recipient, as a substitute for bone marrow transplant, even if it's a completely unmatched, you have way less chance of rejection. This is how different it is. It's a mystery, right? Oh, how does a cell know? How does a young cell know to work with the host? But they know. The younger they are, the more ready they are to adapt. So that's something to really remember. So when you start to grow the cells get older. So you're making new generations as a process. So that's also an aging process. You can age by just living your life, and the stem cells continue to divide, and those stem cells will age that way. Or you can age the cells by putting them in an incubator and letting them divide on their own. So that's another aging process. When you age the cells that way, they start to express surface markers, and because they are under stress, and then you have a higher chance of rejection. So not only have a higher chance of side effects, you also lose efficacy. So there's a study I've shown in some of my presentations looking at a graph of how when you give, 10 times the number of these expanded cells, you have less of a clinical effect. So more is not better. More sounds better, but
Yeah. So you said more is not better. I thought you meant maybe more often is not better, but you're not saying that. It's the concentrated dose is not necessarily better.
exactly each time, because a lot of these companies brag, we give you 150 million cells, we give you 300 million cells. Just be aware that you're getting expanded cells, and you could be
Yeah.
getting a lot more side effects and maybe less
Oh,
efficacy.
I would have come to you instead. My goodness. I should have done my research better. But this is why we're having you on because we just wanted to like really let people know. But how often, if you really were on the search for stem cells to heal some part of your body, how often would you suggest to go? 6 months?
Well, if you're trying to help with a particular condition, um, depending on the severity and how chronic the condition is, then that would determine how often you would need the treatment. I would say if it's an acute injury, we, possibly one treatment, we can knock it down and get people to be a lot better. But if it's a really chronic issue, a lot of inflammation, then you may need waves of treatment, for repair and regeneration. I kind of give the analogy of somebody having let's say bacterial infection, right? You're given a bottle of antibiotics. Do you take the whole bottle all at once thinking you're cured, or are you going to take one every 4 to 6 hours? You're going to take it, in a regimen, because there's a biological rhythm of how your body repair, right? So same for stem cells. You want to respect that kind of rhythm and the complexity. So I would say in general, I recommend 3 sessions spaced 1 to 2 months apart.
Oh,
But depending on different conditions. So that will be
yeah.
the initial stage. Have I seen people who just took one treatment and they did fantastic? Yes. And I would prefer them not to have to come back do another one, because I'm always looking out to save people money. So it would be great if we just do one treatment. They're functioning, beautifully. But I don't want to give them the false hope saying, oh, if I did one treatment and I only had a little bit of improvement, or even if I didn't notice anything, then stem cells is not for me. It doesn't work. Well, sometimes things may be slowly improving, but you may not notice it. Just like when we're getting sick, from one day to the next, you say, oh, I got sick. Does that mean 5 days prior you were not getting sick? So just because you're not noticing doesn't mean you're not getting better. Same thing with, taking antibiotics, right? You keep taking it until you get better. If you're not noticing any improvement, doesn't mean it's not working. No, it means it's working its way. Doing its process. So that's something I want people to not jump into conclusion just because I gave it one shot and it didn't quite feel like anything, then this is not for me. So if that's the case, if I'm making people having that kind of belief, then I'm robbing them of the chance of potentially really doing a lot better. So that's why I tell them, let's just project. Possibly we may need three, but after one, you're doing great, great. Let's just, then it's good. But of course, we are all aging, right? We're all declining with, higher level inflammation. That's part of the aging process. So if you are doing well when it comes to particular medical condition, but are we going to decline? Yes. So if you want to stop the decline, or at least really significantly slow it down, then probably doing a stem cell treatment once every 3 to 6 months is a good regimen to slow down the aging process.
Can I
Um,
ask you, do you do stem cells? I'm guessing,
oh
yeah.
yeah, yeah. I just did it
How
a
often?
few days ago. Yeah,
Okay.
I've been doing IV stem cells on myself every 3 months for the last 7 years, ever since I started. Even
Lucky.
before I before I gave it to any patients. I thought, oh, the science is so exciting. I've seen what it's done for people who have illnesses. I believe, all the similar mechanisms can help me rejuvenate. So I kind of took it on, jumped into it based on faith, and based on what I've read. But since then, there are more studies I've seen who are looking at anti-aging benefits. So that's actually one of the presentation I give, was stem cell therapy as an anti-aging tool. So there's especially some really, really solid animal studies looking at regular IV infusion for the animals and what it did for the animals. It's pretty, the consensus, among different studies is that it can extend lifespan by about 30%, but not just extending how long they live, but making them live much better. So that they're
Yeah.
extending the time that they're living a really good, vibrant, and youthful life.
Yes.
So that's pretty powerful. Yeah.
That's very powerful. And you mentioned cost a little bit earlier, money earlier. The cost seems to be coming down quite a bit, don't you think? From the past?
Um,
Not
I am,
necessarily?
I'm not sure.
Okay.
Possibly.
I would just say, 3 years ago, it was out of my reach for pricing.
Mm,
It just seemed to be more affordable now. And I heard like the way that they're getting it, it's making it more cost effective. Not- I don't
it's
know.
possible. Yeah, yeah.
Okay.
I'm not. I have to do some market research.
Okay.
It's possible, but I think there's going to be, if it's not FDA approved, the physicians are always taking on certain risks. The products are expensive themselves, but the price is coming down a little bit, so that may be passed on to patients a little bit. But if you are not, if it's considered a little bit of fringe, doctors are taking on certain risks. And as long as that's the case, the price is going to, stay at a certain level.
Right.
But if it became more mainstream and is covered by insurance, yes, your insurance is going to help shoulder some of the costs, but not necessarily the price is going to come down. Just to give you an idea, if anyone's interested, watch the documentary Unnatural Selection. It's about gene editing. These are, injections, simple injections. These are, little concoctions made by pharmaceutical companies. And it cost this particular disease, it cost $750,000 for one injection. So, it's a, yeah, so yes, it's FDA approved, but does that translate into accessibility?
Right.
So, yeah, just keep that in mind. I think right now, comparing to the value, like you said, some people spent thousands and thousands of dollars doing things that may not be very helpful. I
Yep.
think this is potentially be very cost effective. So, yeah.
Do you ever see, do you ever foresee insurance covering something like this?
Yeah, and it
Okay.
will. Yeah, it
All right.
will. I
I'll
don't
keep
know
that.
when.
Well, Dr. Joy, I didn't want to take up too much of your time today. Do you want to maybe tell people where they can find you? Because I know you have your own YouTube channel and
Yeah, I would love for people to take a look at my YouTube channel, just under Joy Kong MD. I have a lot of podcasts. Mainly, I started out by just putting out very simple homemade videos, sharing the information because it's just there's not enough, not good enough source online. Just giving people kind of give it to them straight. I'm a very I whatever I know, I want to deliver in a way that's understandable. So people, I want people to have my knowledge, be educated. And then I started doing podcasts and interviewing different doctors and different pioneers in various fields of, health and wellness. So that's an ongoing thing. And then they can find me at our clinic in Los Angeles. It's Uplift Longevity Center, Uplift with a Y. So they can go on the website upliftcenter.com. And I also have my own website, which put everything I do together, just joykongmd.com or drjoykong.com. In there, you will find the different things I do, which include the Chara Omni stem cell cream, but also my book. I wrote a book called Tiger of Beijing. That's a memoir. If anybody's interested, I think it would be a really fun read. It has nothing to do with medicine, but it has to do with a young girl's journey. I came from China when I was 20 years old, and against various obstacles. So it's about determination, about tenacity, about going for your dream no matter what, and believing it's going to happen. You've got to believe. You've got to believe in deep down, believe in where you're going. So it's a very candid memoir. So that's people really love it. They're inspired and they have fun reading it. So that's another fun thing. But yeah, my academy is on there. I train a lot of doctors. So that's kind of the that's where they can find me.
Well, thank you, Dr. Joy. It's been such an honor to talk to you and learn a little bit more about stem cells. Thanks,
Yeah,
everybody.
thank you, Maria. Yeah, I really appreciate the opportunity to share the information, and it's a fun chat with you.
So thanks, Dr. Joy. I'm so honored. If you want to change your life like I've changed mine with food, I would be honored to help you. Many of you don't know that I was twice my size. I had acid reflux. I had PCOS, which is polycystic ovarian syndrome. I had depression. I had IBS, which is irritable bowel syndrome. And food changed my life. And not only did that happen, I get to eat good food, right? Good food. So if you want to eat good food, I have perfected meal plans made by me and personal help with supplements or modifications if you have Hashimoto's, if you have Graves, if you have IBS, if you have PCOS, contact me. I would be honored to help you. You can go to keto-adapted.com and find a lot of different options there for personalized help, or message me by commenting below on this YouTube video, or you can check me out at mariamindbodyhealth.com. Mahalo.